So let's talk about sickle cell anemia. Sickle cell anemia is a kind of anemia that is being inherited in the body. All right. So if you are having a child and unfortunately your child have anemia, it could be transferred. If the parents is having anemia, then it could be transferred from the parents to the child. That is what sickle cell is talking about. It affects the shape of the blood which carries oxygen to all parts of the body. Red blood cells are usually round and flexible, so they move through the vessels. In sickle cell, some red blood cells are shaped like sickles or crescent moons. These sickle cells also become rigid and sticky, which slow and block the blood flow. All right, so the blood flow is going to be blocked, like in aspect of supplying to one place, but it's a kind of inherited. When I mean inherited, genes is being transferred from one parents to the child or the kids. All right, so there is no official cure for this, but prevention and management are there. Some few managements can be done. All right. So what are the symptoms? As usual, anemia, you feel fatigue, you feel tiredness, you feel weakness, all right? You feel body pains, you feel swellings, you feel skin discoloration, and sickle cell, you feel delayed growth, blood helps in those aspects. Sometimes you feel vision issues, of course, you feel headache, and your vision will be affected as well. So on that process you still feel difficulty of walking, confusion, and etc. There's a lot of things you feel, and the causes of this, like I've told you, is a change in genes from one parent to the kid. All right, so complications of this sickle cell anemia can lead to stroke, it can lead to acute chest syndrome, it can lead to pulmonary hypertension, it can lead to organ damages, etc. There's a lot of issues. Anemia is a very, very, very critical part of the medicine that should not be taken for granted. If you're having decreased blood supply to your muscles, it's not a good idea. Find a way to treat it. If you're having less blood, then you find a way and treat it. All right. Now, the diagnosis of anemia, of course, we will use the CBC count, all right, to check if everything is fine. CBC count, I'm talking about the complete blood count. This can be done in the lab, all right.